The next word is cranial. 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 And this means toward the head. The antonym of cranial is caudal, toward the feet. And our first term is craniosacral. Sac or sake, roll. Craniosacral. And the only time that I've heard this term, I'm sure there are other times that I should have, but this is a type of therapy, pain relieving therapy, that relates to these regions. Cranium, remember, sacral is that triangular piece of bone at the end of your spine. So cranial sacral therapy is abbreviated CST. It's a type of, it's hands-on therapy. It's like, I won't say massage, but it is not drug therapy. It's actual physical therapy that is supposed to relieve pressure and tension and improve the functioning of your nervous system. So cranial sacral therapy, I have never had it. I cannot tell you much about it other than it's designed to stimulate the tissues and the vessels to move that cerebral spinal fluid as it should, as normal bodies should function. But it's a good word, craniosacral. And then this one I have seen and heard of. This is craniectomy, craniectomy. And you know what ectomy is. And you know what crane means. This is skull in this case. Ectomy is surgical removal. And this is sometimes done to relieve pressure in the brain. Patients who have been in car accidents and have swelling, edema in the brain. Craniectomy is done to remove a section of the skull to allow that brain to expand until it heals. It's also done to access the brain for surgeries. You sometimes will see a section of the brain, the skull cap, the cranium removed for surgical purposes, life-saving surgeries usually. Sometimes in autopsy you get patients who have passed away from injuries in a car accident, and they will come to you with craniectomies where the surgeon has tried desperately to save the patient. But this is a surgical removal of a section of the skull.